Good day, respondent. First and foremost, I would like to thank you for joining our survey in hopes of improving the research. In this slide, we can see that this is the standard way of doing record keeping in institutional clinics. And these are the problems that we have found regarding on this topic. First, it compromises data security. Secondly, physical documents and conventional file systems are a hassle to maintain and it's an inefficiency of space. And lastly, separation of systems will result into a slower and cumbersome way of passing around data. This is where we come in, introducing SAMS, a smarter and faster way of record keeping digitally. With SAMS, it is equipped with keeping health records, physician order entry, and clinical decision support system. And not to mention, it's all digital. Now, what is SAMS? First and foremost, the definition of SAMS is Smart Accessible Medical System. Now, with SAMS, it's an all-in-one record-keeping system intended to be used by institutional clinics. So this is the significance of the SAMS application. And as you can see here, this is the standard way of record keeping. As to your far left is the individual health record form used to record patients. And at the very middle is the prescription form. Now, what if it will be converted to a digital form? So the next part of the presentation is we're going to do a short demo regarding on the nurse role. And as you can see here, this is the list provided on what the nurse can do inside the application. So first, the nurse is able to create a medical record for the patient, create notes, create a patient's present illness form, create a prescription, use CDSS utilities or clinical decision support system utilities. They can also upload laboratory result, search patient by name or student ID, search the diagnosis, sort the diagnosis by date, and navigate through the application. So this, let's enter the uh, nurse details. So Danilo. By logging in, mo ni ang makita sa nurse. So naatay dashboard diri nga makita diri ang summary sa mga pages nga pwede maadto sa nurse. Search a patient, home, health records, or medical notes. Let's imagine a scenario that the nurse is going to create a patient. So if mo pislit siya aning drop down located diri sa app bar, diri siya pwede maka-create og patient. So the patient is named Enrique. And if they're going to click on this civil status, makita natay drop down diri nga pwede siya makaselect ani nga options. Natay single, married, divorced, separated, or widowed. And nasa tay options diri nga male and female. And ma-enter sa nato ang iyang birthday. And below that, naa diri ang department sa student. So School of Engineering siya. And he's a 4th year student. And with this, we can also insert the student ID sa patient. And mabutang nato o taga-asa siya. Wherein mabutang nato ang address sa patient. Oops. Cebu. And in terms of sa height, pwede sa nato mabutang diri in centimeters. And ang weight sa student. These two options, active email and contact number, is optional kay aton gyasyo nga wala ay contact number ang patient or wala ba siya active email. So these are optional. So let's just say nga na ay contact number ang patient. And below the general information section is the medical information section wherein pwede ta makaselect sa unsay past diseases niya, say family history nila, allergies, some of that. And let's just say the patient has asthma and eye problem, and also a cancer. What the nurse can do is, if ever they change their mind nga wala day eye problem ang patient, pwede tam click aning X na button para ma-remove to nga selection. And for the family history, let's just say nga ato napislit ang NA and napislit na to ang thyroid problem. So if you're going to click on submit, there's gonna be a pop-up will show up saying, "Are you sure? It seems that you've selected NA and selected an illness." So what we're going to do is we're going to correct it. So let's correct that and click on submit. And if going to go to the allergy section is, let's just say nga wala dire nakalista ang allergy sa patient. So we're going to click on other and insert the uh, specified uh, specified allergy, insects or animal fur or even pollen. And lastly, uh, we can also do this in the other selections, pollen. And by the last section of registering the patient, we can register their emergency contact person. And their contact number is this. And by clicking this button, save address as above, we can copy paste the address of the patient listed above. And so if you're going to look, this is the patient that we've created, and we can see the uh, information that we've inserted for this specific patient. So with this, uh, let's also imagine a scenario where the nurse is tasked to diagnose the patient. But before we can do this, they must have a consent by their physician. Now let's assume that they already have their consent by this physician. We can diagnose the patient. Let's say the chief complaint nila is coughing or dry cough na ay tonsils or just a disclaimer, I'm no medical professional, but what I'm going to do is insert dummy data in the present illness form. And they're diagnosed with pneumonia. The patient is diagnosed with pneumonia. And what the nurse can also do is uh, create a prescription. So with this, they can just search the specified tambal, and the signature is take 3 times after meal for 1 week, 21. So this is the prescription. The patient will take this for their treatment. And by the last section of the present illness form, they can see a summary of their inputs for the complaint, findings, illness name, diagnosis, and the treatment. They can also see the prescription below that. And if we're going to click on submit, it is then reflected on the history of present illnesses. Now that we have created a diagnosis, let's just say we're going to use the CDSS utilities for the nurse. So to use them there are two options. One is EDP and SDP. What does EDP stand for is Evaluation Disease Predictor. In this, they have to ask commonly asked questions. Does the patient have fever? Does the patient have cough? Does the patient have fatigue? Is the patient experiencing difficulty in breathing? What is the blood pressure of the patient? And what is the cholesterol level of the patient? So with this, this is a yes or no form. And for the blood pressure and the cholesterol, they're just going to select low, normal, or high. So let's just say These are the selected forms or selected inputs, and we just have to click on submit. And with this, we have a result of osteoporosis by 25%, and the migraine, they have 23%, and stroke 20%. So this is what the evaluation disease predictor does using machine learning. So let's just say that we're going to use this value. So this is the summary for the evaluation disease predictor. Now let's just say that we want to use the SDP. So by clicking on the SDP, we have a symptom disease predictor. To use this, we can say add symptom. The patient has continuous sneezing, skin rash, and itching. To use this, we have to insert a minimum of 3 symptoms to have a somewhat accurate result. So let's just say we're going to insert 4. So the patient has joint pain. So with these 4 inputs, we can analyze this and have a suspected disease result of fungal infection. So the confidence score is 100. With this, let's just say the patient has a fungal infection. With this is the recorded illnesses for the patient using the EDP or evaluation disease predictor and the SDP or symptom disease predictor. So if we're going to look onto another patient's record, as you can see here, this is the list of the users inserted. What the nurse can also do is they can sort the list by recency or by date. They can also search the illness. And what they can also do is, let's just say we're going to find a specific patient. They have to click on the search bar and find their specific patient and go to their info. And the next part of the presentation is the creation of notes. So with this, let's just say at 9 a.m. with Doc Pakuna. So by creating notes, they can also have a to-do and also edit their specified notes. Let's just say that the nurse has a to-do and they've already completed their to-do. So it is reflected on the completed tab. And if they change their mind, they can just also click on the check box, and it is reflected back to the to-do. And what the nurse can also do is upload the laboratory result of a patient. So this is the website part of the application. So we're going to log in as a nurse. This is what they're going to see. So this is this dashboard, and what they can do is upload a laboratory result or select a laboratory result to scan. So let's just say that patient Mark Talandron has a laboratory result that needs to be scanned and reflected here in the past laboratories. So what we're going to do is upload a complete blood count, and okay, so this is the file for it. And what they can do is just upload the complete blood count and it can be recorded in the system. So submit, and the scan laboratory result successfully. And also it also says check results on the SAMS application. So if mo tanaw tani nga tab sa past laboratories, makita na to ang details ni pasyente. Na diri ang investigations, unsa nga gipangita, there sa hematology, kita na to ang values o references, and ang biochemistry niya. So with this is the nurse demo part of the application. Thank you for watching.